So I welcome all the participants to this program. So I think we can start the program. So once again, I welcome all to this program. So this program is being organized by Medi-Hub Technology Business Incubator, which is again ICR's initiative, which is working on various, supporting various entrepreneurs in terms of converting their ideas into business. This we have established 2 years back, and at present we are having more than 20 incubators working on various aspects of enterprise development. And we regularly organize the entrepreneurship development programs like this. So what we are having today. So this is the 20th program that we are organizing since our inception. And so focusing on various domain knowledge, domain specific things we will be addressing. This Deepa. Dr. Deepa, you will be the co-host of this meeting. So you can. So let me introduce our speaker today, Dr. Manish Pandey. Sir, welcome to you, sir. So I can proceed with the session. I think so with your permission, so we can go ahead with this one. So Dr. Manish Pandey is presently the Director and Head of Project Analysis and Documentation Division. It is known as PAD Division at Quality Council of India. It's an independent autonomous body of Department of Promotion of Industry and Internal Trade, Ministry of Commerce and Industry, Government of India. QCI's mandate is to lead nationwide quality movement in India through various boards like NABH, NABL, NABET, NABCB, NBQB, and Special Projects Group. Dr. Pandey has done his PhD from Indian Council of Forestry Research and Education. Furthermore, he has published numerous studies and papers in peer-reviewed journals on agroforestry and sustainability, including UNC TEDI research paper on PSS. Prior to joining to QCI in 2012, he has worked with SGS India Private Limited as head of government and forestry services. He has been an invited speaker in many international forums and also a visiting member of many of the organizations and committee and African Organization for Standardization, ARSO, at the flagship intergovernmental and governmental initiatives such as India National Platform on Private Sustainability Standards, Design and Development of Conformity Assessment Frameworks for various schemes such as UAS drones, DGCA, medicinal plants like NMDB, this voluntary certification scheme.
Sir, we can't hear you.
Sir, we have lost you.
Sir, you'll have to unmute.
Sir, you are on mute. Please unmute, please.
Okay. So I was introducing Dr. Pandey.
In between, we lost you. So kindly, connect your talk.
Yeah.
I think so. Doc Sahab, leave it. We can discuss. That's okay. People can.
Yes, sir. With this, I welcome all the participants to this program. Dr. Pandey is very, this lecture will be very, very useful because Because whenever we are talking about certification, who will be the certifying agency? What are the formalities for certification? All those things. So we will come to know in this. With this brief introduction, sir, I welcome you and over to you, sir. Yeah, go ahead with your lecture, sir.
Okay, I hope my screen has been visible to all of you.
Yes, sir. Yes, sir.
Yes,
It is
sir.
visible.
Okay, yeah, formally I should thank DMAPR and the Hub to identify Quality Council of India as one of the speakers. And what I'm going to do is I'm just going to talk to you about the quality initiative that Quality Council of India does, who I am representing at this point of time. I would talk about certain concepts, the way we function as the the quality ambassadors in various sectors. And I would also talk about the medicinal plant produce, which people are doing. And we are closely working with the MAPR and a lot of its scientists and other officers for a project that we are executing in very close cooperation with the National Medicinal Plant Board. So let us talk about what we people do. When you talk about certain things which Quality Council does, it talks about seeing that we have zero tolerance for substandard products and services. The Department of Commerce also talks about standards are interpreters to understand a product, which is what we people do, that we make a lot of standards across various sectors. Regulations will help maintain quality standards to bring down costs. So these are some very words of wisdom which we see from the political leadership and also from the apex of the bureaucracy and policy makers. We have been hearing about the importance of voluntary standards. We also talk about something to do with a lot of associations voluntary coming and making standards. We see a lot of experts call for global accountability, and we are also not only talking about quality in terms of medicines, but also in various walks of life. Now, let me come to the point. This is the main slide which will talk about what is the compliance and how compliance is driven into various sectors. Compliance basically has been driven by two entities in any economy. One is the government, and the government focuses on health, safety, and national security. How does it do that? It actually comes out with an act. Then the rules are framed. Then a regulator is established. The regulator focuses on seeing that the regulations are being implemented. Once they see that the regulations are implemented, then they issue the licenses. Whom do they check? They check primarily whatever is the act or the rule focuses on. It could be a primary processor, manufacturer, supply chain, service provider, aggregator, or retailer. And why we do this? We do this to see that the consumer or the citizen of the country receives the benefit for which he pays for a particular product, service, or a process. Once the regulator does give the license, they have mechanisms of doing surveillance, so that at all period of time we see that the surveillance and the level of compliance is at the highest level. Now let us talk about voluntary mechanism. Now this is the mechanism which Quality Council of India drives in the country. Our focus is on quality, competitiveness, and global trade. How we do it? We talk about a market-driven compliance, which actually crosses the geographical boundaries or the political boundaries of the country, and it goes, regional or global. How do we do that? We do it by, design and development of a voluntary scheme, where we either find a scheme owner or we ourselves become a scheme owner, and I will explain that concept lately. And how do we conduct our business? Our business is conducted through confirmatory assessment bodies, which means a body which is either a certification body or an inspection body or a testing lab. So based on what is the scheme looking at is the way the assessments are done. How do we do it? The conformity assessment bodies or CABs would visit again the processor manufacturer as the scheme is designed, and they would see compliance, and then they would issue a test report or a inspection report or a certification. We do it exactly as the government does it. And also the idea of voluntary schemes is to, as what the government says, is that the citizen receives maximum benefit while paying for any any of the product services or processes that they want from the industry. Now, let us talk about some concepts. First, we talk about standards. Standards we understand as voluntary, as something which are voluntary, and the other ones which are mandatory. When you talk about mandatory, they become technical regulations. Most of the voluntary mechanisms. I will talk about both the voluntary and the technical regulations, but let me talk about the other concept, which is about vertical standards and horizontal standards. Vertical standards are basically product related standards. However, horizontal standards are standards which cut across various sectors. I will give you a horizontal standards example. For example, let us talk about the 9000. The 9000 standards, you will find that a railway station, a police station, a big multinational, anybody can be certified against that particular standard, because it has so general requirements that it would certify anything which has those basic things. So when you talk about 9000, it is basically about the quality management systems of anything. So a railway station also could have a quality management system. A police station definitely would have one. A train could have a quality standards in terms of staffing, catering, onboarding of passengers and things like that. And of course, when you talk about vertical standards, they are specific to a product. So when you want to talk about a specific product, for example, the ink in a pen, and in terms of its viscosity, in terms of its flow, in terms of the volumes or refill contents, and how much will it write. So when it comes to that specific, when you talk about this specific standard, then we name it as vertical standards. So when you talk about voluntary mechanisms, they are voluntary standards, private standards, and private sustainability standards. Certain standards which are on the natural resource management realm, for example, anything which is to do with forestry, aquaculture, organic, things like that, or maybe medicinal plants. In that we talk about sustainability. So as far as QSCI is concerned, we have voluntary standards as Ayush Mark, this particular voluntary certification scheme for medicinal plant produce. We have something for agriculture. We have also for ICMED, which is Indian certification for medical devices. Then there are private standards. The private standards are basically made by people who actually are, private bodies. It could be retailers and other people. And Global Gap is one good example. When you talk about private sustainability standards, these standards are basically about, forestry, where sustainability is an important aspect. So we have these FSC and PFC certification. Now, when you talk about standards, standards is a bigger umbrella. Inside it, we say that there could be a voluntary standard, there could be a private standard, and there could be a private sustainability standard. Now, let us talk about what QCI does. Now, QCI is a part of a bigger umbrella, which we call it as the quality infrastructure. You people all would know what is a infrastructure, but quality infrastructure basically is constituting of three main entities. One is the national standards body, as we all know, is the Bureau of Indian Standards, or BIS. We have the NPL, which is the National Meteorology Institute, which is loaded with the responsibility of having traceability. And then, of course, is the Quality Council, which is the national accreditation body. And this role is dispensed by two of its R boards. One is the NABL, and the another is the NABCP. We are functionally autonomous and financially independent. We currently are under the DPIIT, which is a body under the Ministry of Commerce. So this is our leadership. We have a chairman and our chief executive officer. Now the chairman is, as you see, has impressive credentials. The chief executive, Dr. Ravi P. Singh, leads from the front, and he is the one who gives us a lot of direction and insights to see that quality is something which is a 360-degree concept, not that we do one part and leave the others. And this you will see in the scheme that I would speak about. We are typically having the five accreditation boards. Basically, the four are the ones who focus on accreditation, and the fifth one is about quality promotion. I had a division called the Project Analysis and Documentation Division, and our main function is to develop and design frameworks which are as per international best practices. The schemes that we generally run have a governing structure. It has a technical criteria. It has a certification process. It talks about the requirements of certification body, and anything that we do has a certification mark. So what does certification does for business entities? It is a tool that gives the confidence that the particular produce has been done through a quality process. It in certain cases opens new markets for business, and of course it is conformity to a stated standard. For consumers, for consumers, it is an assurance of conformity, because if you tell your child, or if somebody has to go for buying electric appliance, we will always say, oh, go and see that it has the ISI mark. So these are some things that we also do while we design our scheme, so that the consumer gets a lot of confidence that whatever he is buying has some value. Now let us talk about this particular subject which has been given to me. This is about the voluntary certification scheme. I have already spoken to you about the emerging scenarios. We will talk about the current scenarios, the approach that QCI has taken. We also would talk a bit on the GAP and GFCP, though I have been given the topic of GFCP, but both are quite interrelated. We will talk about how development of scheme is there. We will just give you a heads up about the testing requirements and the way forward. Now, this is something which just I spoke to you. It has been represented in a different way, but it conveys the same meaning as I've just told. Everybody is aware about the current scenario. The third point is of utmost importance when we are talking of a extremely complex, secretive, traditional, and to a lot of extent unregulated. So this is where the problem statement is there, and we are trying to do is to have the change driver as the markets and the ones who procures. And how we are trying to help it is by designing a voluntary code, and I will speak about this. Why I say that India is at the right stage to adopt for voluntary certification. This is because that we have a lot of consumer awareness, we have requirements now, we have a very favorable regulatory environment. Traceability, as I've just explained to you, is most critical. There is livelihood issues when you talk about doubling the income of the farmer and things like that. And of course, as a country, we have a huge production and supply strength. Now, how are we doing it? We are doing the medicinal plant sector by both aiming towards the good agriculture practices and good field collection practices. Now, this is done for the primary aim to see that we have quality raw material, which is going to help the Indian system of medicine acceptance of a science-led and science-based world. What are we trying to do is to first do a production and collection system which has sustainable, and of course later on we will talk about traceability, so that we are maximizing our sustainable output in the production system and have a traceability system which will assure the consumer or the middle aggregator that everything which is coming from compliance market. Now sustainability, when you talk about sustainability and our kind of work, we talk about conservation, we also talk about consumption. Commercialization is important because this is where livelihood issues are there, and of course all the three when converges makes a good business case to talk about sustainability. The components that we have addressed in our scheme is best practices, traceability, stakeholder consultation, adherence to relevant rules and regulations, and fair prices, wages. And of course, ABS is a concept which most of you would know, because till the time that any pharma company wants to approve something which is of critical importance, they have to pay some compensation to the locals, so that they don't just plunder. They actually give farmers or communities the incentive for them to keep on growing it. Maybe the multinationals are coming and picking the things up. So we have two standards, as I've just explained to you. It is basically GAP and GFCP. So the good agriculture practices is something which talks about best practices. We talk about inspection in production, storage, and transportation, and of course there will be an process of internal quality control. The GFCP standard is something which focuses on collection practices and traceability, and here also we are talking of workers' health safety, because most of the time he will be perched on a roof, on a treetop. How is he going to sort of safeguard his own health and well-being is something that we look in our good field collection practices. Now, this is a very nice diagram. This shows that how we function. So we have this scheme which is owned by NMPB and QCI. How we have made the scheme is through three stakeholder committees, whereas the SC stands for the steering, the TC stands for the technical, and CC stands for the certification committee. And of course, this is committees which is made up of the Ministry of Ayush, the National Medicinal Plant Board, growers, collectors, consumers. And what we do is once the scheme is made, we get it through a process of accreditation. Once the accreditation is then the certification body goes to the farmer for the GAP. It goes to the collector when it comes for the good field collection practices. And of course, when it is primary processing, they also focus and address this while they do the certification process. What do they see? They see that the standards and whatever are the practices are met. So the farmer has to show his compliance to the particular standard. And once they show compliance, they are given a certification. So what does the certification show? It shows compliance to the best practices, and in certain cases, it also gives them some kind of a premium that might range from 0 until 12 to 15% based on the product and the markets that they are selling. As I've just explained to you, we have these three committees. We have these 5 stages. The fourth stages is where the scheme is finalized, and the fifth stage is where it is launched. And usually what we do is, as I've just told, that the launch will accompany some kind of a trademark. So currently we have this above a lady in a field, which is the GAP trademark, and the below one with the red sari is focusing in some kind of a harvesting of some fruits, and this is where we call it as the GFCP mark. So these two marks will be there. I've just explained to you that what all are being seen here, and then we have these various criterias which are up in the website that will show you the compliance. Now, once we have done this, what is the process? The process is simple. Now, if any of your projects wants to get certified, they will go to the certification body. There is an application form which will be sent. Once the application form is sent, then we will have people to fill it up. It goes back to the certification body. They prepare a proposal. Once the application is met and the fees are paid, then you see that there is a process where the certification body will check the documents, see the internal control system, see the various audits, verify the major cars, which is the corrective action request, prepare a file review, and if everything is fine, then they issue a certificate. And this certificate can be then shown in the market to either gain access or to show that your quality is best. Now, in a country like India, there is a lot of queries that, sir, certification means it is something where, the farmers are ripped off, they have been overcharged heavily and things like that. So the answer to that question is no, that is not the truth, because as a country, we focus on a group certification where, at least to my knowledge, I have myself in my previous work certified a group of 7,000 farmers where the cost of certification was not even rupees 300. So that is something, it is as cheap as it. So what is a group certification? You have a lot of farms. You have a group manager who has the responsibility to see that all the farms are working. Now, this farmers farms are the ones which are, are handled by a group manager. This manager shows that the product is that the farmers or the collectors are maintaining their own standards. And what happens is that the auditor comes, he checks the works of a group manager, and then of course see whether the farmer has been doing his work. And if everything is fine, the group is certified. Now, what is the beauty of this? So we say that usually it is a square root system, where if there are 100 farmers, the certification body will only go and check 10 farmers. In the 10 farmers, if everything is compliant, the 90 would be benefited. But sometimes there is a problem. If then one farmer is not compliant, then 99 goes for a toss. So it is a tricky situation. So we leave it to the group to show that, what is the way that they want to. And if they are doing a group certification, then the group manager has to be really a smart person who can tie all the loose ends before the certification body comes. Now, these are some kinds of certifications that we do in our system. So we have this option 1, 2, 3, and there are actually two levels. The first level talks about only GAP and GFCP certification, which is more of a field certification. The level 2 is the compliance, which talks about a lot of chemistry, and then they check the active principal ingredients and then only certify it based on the content that a particular thing. So if a curcumin content or a azadirachtin content is high, then that certification will actually certify that content so that the buyer can fix the price accordingly. So this is how it is. There are various test methods which are required in this particular scheme. It will be talking about residual analysis, heavy metals, aflatoxin, and bacterial load. And once all these tests are as per the requirements of the scheme, the certificate will be given. Last 2-3 slides. What is the goal? The goal is to enhance quality of medicinal plants, to assure reliable supply to Ayush industry, to facilitate international acceptance, rigor in implementation, and wider acceptability, a tool for regional trade. And now we have a scheme which Dr. Reddy is very keenly associated. So what have we done is we have done a lot of training material with us. We have done about 50 odd workshops, and we intend to do another 50. We are talking of the POPs. So we have out of 140 done some 80 POPs, and they would be released in and kept in the NMPB website for free access. We are also identifying certain demo plots where we are implementing the package of practices to help them to conduct the pilot studies. And once the pilot certifications are over, I think so the task at hand will be over. Now, I've just explained to you all this. Our major stakeholders are farmer, collectors, aggregators, traders, packers, retailers, and consultant. We also focus on Ayush manufacturers, funding organization, NGOs. We engage a lot of SMPBs and the state forest development programs. Now, this is the kind of activities that we are doing. As I've just explained to you, we have a lot of training workshops, package of practices, demonstration areas, and somewhere we will publish this as a program. Now, what are we doing for the promotion of quality in medicinal plants? We are talking of public procurement so that it comes in the GEM portal. We are trying to tell NMPB that please make it a mandatory thing for all the projects to adopt GAP and GFCP. Their subsequent tranche of grants should only be given once they are certified as certified as per GAP or GFCP. We are ourselves working to have it as a regional standard. And of course, we are trying to dovetail it with the Ayush mark, where we are going to give Ayush mark only when that these people will give us, that once the manufacturer will procure only GAP or GFCP certified medicinal plant produce. So, and of course, we have asked the NMPB to also have ourselves in the e-charak, so that all the certified produce will be kind of procured from this portal of e-charak which NMPB has made. So this is what it is. Of course, as a division, we do a lot of international projects. We have helped the SARC regional standards to have good agricultural practices. The photograph is about a discussion with the Maldives, which have come up with this thing. We are also in talks with a lot of countries. We have signed an MOU with both these two organizations, Mexico and Brazil, and we are wanting to do something with the African regional organizations. We are also working to make the VCS MPP as a regional trade for sustainable development, where the SARC Agriculture Council is talking to the other 7 members SARC and 3-4 more members from the BIMSTEC to see that this is going. Now, this is the long and short. This is where we are all there in the global footprint. So we are there in many countries. Either we do some projects or another, and then I think so there is a lot of credibility. Now with this, these are my credentials. I've put my number there, and of course, this is what I wanted to share with you all in terms of the project that or the initiative that Quality Council has taken. Now, with this, I request if there are any further questions that you people have. Thank you so much for patiently.
Thank you very much, and very short and sweet presentation. We enjoyed listening to you, sir. Thank you very much. And I think certification is one important thing that because efficacy of the drug again determined by the quality of the drug, and unless you certify the material and give a certificate, it is very difficult to have quality assured with the Ayush products. In this line, sir, your representation is highly useful, and now I open it for discussion. If any questions from the participants.
Yes, sir. I have a few questions.
Yeah, Nitin, come on. Yes.
Yeah, yes, sir. Yes, sir. Thank you for your presentation. It was very informative, and of course, it was very intensive. But whatever we could observe, hopefully, this will be shared with us. I trust.
Yeah.
My questions are predominantly related to export market, Europe or say America. So with regards to MEPs, I want to understand which MEPs are approved or recognized in the union list. Especially, I'm talking about Europe. So my plan is to, use them as food additives or MEPs which are suitable. I should be having a product which could be used as food additives, and I want to venture into export
Dr.
market.
Pandey, you have anything on this?
Okay, see, I will tell you, different countries have different regulatory requirements. Now, you have to be clear that if it is a food additive, you will have to follow the importing country's requirement rather than the country's requirement, because you are going to be, sort of exporting it to that particular country. So I think so you should focus more on the importing country requirements. As far as we are concerned, these certifications are something that are talking of the production systems, right? They are not talking of the processing part. If you want to have something on processing, then maybe you should, and if you are wanting to push it as a packaged or a processed food, I think so you will have to get in touch with either EIC or with the FSSAI, and they are the ones who would help you in telling that what is best. Maybe EIC would be a better one, because they are the ones who are focusing on the export rather than the FSSAI. FSSAI is more of imports and domestic markets.
Sir,
So
I
yes,
will give you an example. Sorry to interrupt. I will give you an example. Like say, for example, if I plan to use moringa and I want to sell it as a food additive, moringa, it is not recognized. So there's a process where that product has to be approved yeah, for selling in the European market. So if you understand my question correctly. Anyways,
yeah,
what
of
your
course, of
suggestion?
course. No, no, of course, I will tell you. See, everything you have to understand. There are two ways of agreement between trading countries. One is that either they are a part of the GTG, either agreement or arrangement. And if there is a reciprocity, then it can be very easily done. So you will
Correct, correct.
not have to bother with lot of administrative or technical matters. But if that is a new product which is going to a new market, then I think so you will have to file a dossier giving all those requirements and also some 20 years back data. I think so food is a simpler matrix, but if it is medicine, it takes something 20 plus years to prove that it is both safe and efficacy of the product is up to the mark for that country to allow you. So, but food is simple. But as again, I am telling you, it is more of a importing country requirement rather than you show compliance. If you show a local or a domestic compliance, it will be only useful when these two countries, India and the place where you want to import, both have some
Mhm.
kind of an arrangement or trade arrangement.
Got it, sir. One more
Sorry.
question,
Yeah.
sir. Quick question.
Mm.
Regarding the equivalence of GACP and global gap, especially with regards to tracing and sustainability standards, and in the area of medicinal plants. So, is the system in place where we could, who are the agencies who would be, certifying which are equivalent to global gap, or is GACP accepted as equivalent to global gap? Is it incorporating the tracing and
Okay,
sustainability?
okay, fine, fine, fine. Stop, stop, stop. I
Sorry,
understand.
sorry.
So,
Okay.
no, no, because there are other participants, and I got your point. So, I will tell you, Quality Council of India is working with APIDA to get a benchmarking of gap with global gap. Now, that is focused on certain commodities, and the focus is on fruits and vegetables, because these are the only two commodities which are being exported from India, specifically grapes, pomegranates, and stuff like that. Now, medicinal plants per se, to my knowledge, is not something which Global Gap has very effectively been, in their portfolio. However, saying that, when you talk about gap is always good agriculture practices. Sometimes people confuse everything in the world with Global Gap. It's not your fault. It is the beauty that the Global Gap has a strong marketing team. So anything gap is Global Gap, which is not so. If you talk to countries, actually gap comes from a technical term which FAO uses, which has basically four pillars of food safety, product quality. It also talks about environmental management and work and health safety. So these are the four systems. Now, if you, as a part of the government of India, does something which caters to all, you can actually go and tell that your medicinal plants are GAP compliant. Quality Council of India, under the scheme of VCS MPP, which is the voluntary certification scheme for medicinal plant produce, actually has all these components. We have ex-director of DMAPR as the advisor and the chair of the technical committee. So whatever we guys do, I think so that gives everything. You spoke about traceability, the answer is yes. You spoke about product safety, the answer is yes. You talk about produce quality, storage, everything is there in that scheme that we run. And in fact, very quickly, I will tell, and I'm not sure whether DMAPR is there, but NMPB is definitely there in that discussion, where a whole consignment of Cipla in terms of their produce of Cassia angustifolia is stuck because they are not being able to show that it has come from a GAP certified farm. So there was some, I think so, was it? I'm not getting the active ingredient, but the active ingredient which Cipla processes and pushes to Russia for pharma activities is somewhere stuck for
It
want
is
of GAP.
senescites. It is senescites, I'm
You're,
correct.
yeah, you're right. Sinusides.
Mm.
So that is something that they are still, getting to this thing, but slowly compliance is coming, where the importing country is now demanding gap. What happens is when the country demands gap, then somebody, some smart person, some commercial change, talk about global gap, and the whole discussion goes to agriculture. Whereas we as Quality Council are now talking to governments and telling gap is like it can be India gap, which is much more easier, much more simpler, and much more what do I say? Sasta,
Okay.
not cheap in that sense, but affordable in that sense, and it also focuses on the Indian conditions. Okay, stop. I'll
Yeah.
stop here.
Yeah. So one
Sorry.
more, sir, there is a question in the chat box that why the voluntary word is there in our scheme? Why not it is mandatory?
And the government will
Pandey,
say,
yeah.
sorry, there is a lag, I think so. So I will tell you, voluntary means that at this point of time, the government doesn't want to make it mandatory. And when you talk about mandatory, then if you don't have that product, you are stuck. So, and of course, you need to have the system. So government usually is very careful when it wants to put in anything under regulation. As far as Quality Council is concerned, at this point of time, we have only 3 to 4 certificates available, right? If it would have been 4,000 or 10,000, the government would make it mandatory because the government can't make mandatory and also not give the produce. So the government is very sensitive to such matters. They will see only when there is a success and when there are volumes, then only they will make it mandatory. Otherwise, trade will halt. That is the point.
Sir, do you have any list of certifying bodies?
Of course. If you go to the Quality Council website, and of course, I'm sure Dr. Reddy would know that. I can type it very quickly, and you can access it, and you can get it. So while I talk to you people, let me just paste the link of that. QCI. Okay, you carry on. So yes, I'll paste that link, and I think so that will help you out.
Yeah. So any other questions from the participants? Maybe Krishna might be having something, or Devang.
Sir, can I, if sir doesn't mind?
Yeah, please.
Sir, who is certifying fair trade compliance, sir? Any Indian companies?
So they would have lot of people who can certify. So you go to the fair trade, there would be fair trade auditors which will on their name come and certify. So I'm not sure whether there is any organization per se, but long years back it was
So the thing is, if I have to prove that my sourcing of medicinal plants complies with the fair trade practices, TriFed is one of the organization by government. So could it be? Will it be possible that sourcing from TriFed possibly could be a fair trade compliant sourcing?
Yeah. See, I will tell you, TriFed will have. TriFed will have to prove that they are doing, plowback of the per rupee that they are getting back to the farmers, and that either they can do it by simple mathematics and an auditor signing that off, saying that okay, of the 1,000 or a lakh of rupees that the TriFed has got from selling of the farmer produce, this much is going to go back. And if their auditor signs off, but then if you talk about fair trade, because it is by name you're naming a scheme, in that case only the fair trade auditors will come and they can review it and give their report, and if you're compliant you can have the certificate.
Yes,
so that is possible.
Agreed. Agreed. Because the highlight is already government has a MSP, what do you say, notification in place where certain MEPs are having MSP. So this is a unique point where fair trade, one of the aspects of fair trade could be, met for compliance.
Okay. Any other questions from the participants?
Good afternoon, sir.
Yes, Kaushal. Yes, come on.
Yes, sir. Sir, thank you, sir. Very nice awareness about certification. My basic question is, sir, that when Ayurvedic pharmacopoeia has a specific standard for all the parameters of the medicinal plant raw material, and it is already in the website, Ayurvedic pharmacopoeia in the different volume. What is the basic difference of this Ayurvedic pharmacopoeia standard and this kind of certification?
That's a brilliant question. So let me answer it this way. Once you have prepared your jalebi or laddu, then you can't dismantle it in terms of its composition, in terms of its sweetness and other things. What this
Yes.
certification does is that it prepares you from the very beginning that what should be the right kind of ingredients in the process, so that you get a desired quality and quantity, which of course is very well written in the various pharmacopoeias as you have mentioned. So what the scheme does is prepares the farmer or the produce in a certain manner, so that the raw material after being harvested actually meets all those requirements which are done in the pharmacopoeias. Otherwise, what happens is the farmer blindly puts lot of chemicals and pesticides, and once these chemicals and pesticides in some cases not even prescribed for that crop, leaves a lot of contaminants into the final produce, and that results not only in the rejection of the produce at the buyer's end, but also gives the country a very bad name. So, beautiful question. The answer is that we are only helping the produce to be prepared in a manner in the field, so that once it is harvested, it gives you the exact requirements as mentioned in the various pharmacopoeias. Does
Thank
it
you,
make
sir.
sense?
Yeah. Thank you, sir. Thank you.
Sir, there is one question that, say, if I want to start certification of my form for GAP certification, so when I have to start, and how long it will take for me to get the certificate?
Okay, unlike organic certification, which will take you 3 years, this will be done if you are compliant in the closing meeting during the audit. So while you so the first question is that you need 3 months prior preparation before you actually go for a certification. That means you have to have proper invoices of the planting material that you are taking. You start from there. You should have whatever you are purchasing in terms of input, all receipts and things like that. You should have all formulations, all commercial entities as paperwork with you, so that when the auditor comes, because mind you, in 1 year the auditor is going to only come and stay with you for 48 hours, right? Out of 365 days, in 48 hours he needs to see that you are compliant. And how he would see, you have to help him out by showing him all these documents and things like that. So quick answer to your question is 3 months in advance you will have to have all those requirements, all those soil preparation, your own justification of the site that you have selected for this thing. So 3 months prior, before you sign in an application, all those documents should be there. I hope it's okay.
Yeah, it is okay, sir. It is okay. There is one more question in the chat box. When an aromatic plant can be used for making drugs, is it need certification for cultivation? I don't know.
Yes, now it has been seeing the Russian regulator. I think so it is going to catch up.
Yeah.
अभी तक तो हम लोग we are talking of voluntary. Now the markets and the regulators want it. So slowly it can become a mandatory thing. So let us see how it goes.
Market driven. So
Yeah, market driven. But now Dr. Saab, if people are now asking it as a prerequisite for trade, now it is slowly becoming a mandatory thing and no longer is voluntary. So I just want to raise that.
Yeah. So I think if any more questions? Wonderful session we had. So within a short span of time, we could learn about certification and how the certification has to be done, who are all the players available. And I hope, so if any questions, so Otherwise,
Sir, I have one question, sir.
yeah, Jeevan,
Yes,
yes.
Sir, out of this medicinal plant for the normal agriculture produce, many people they are asking the GAP, sir. So what are the certification bodies are available for the general agriculture for the GAP, sir?
Apart from medicinal plants,
yeah, I've just shared a link to you. I can share the meta link also, which is my division's link. You can kindly, check there. There is a gap, there is a gap scheme which we call it as IndGap. Kindly go there, and you will find this. So okay. So this is another link. I'm sharing it with you, and you please go through it. And if there are any questions, I've put my phone number. Please contact me, and I'll be very happy to answer all your questions. So there is at least 3-4 organizations that are wanting to that already do certifications in GAP. So I've just you can just click that link schemes and just see the India Good Agriculture Practices. I think so that is the first scheme in my portfolio of schemes. So that will give you the CBs which are accredited.
Okay, sir. Thank you, sir.
Yeah. So any other questions? Anyone? Okay. This entire session will be there in our YouTube channel, Medi-Hub YouTube channel. One can see, and you can contact us if you have anything to be done. So if you have any glitches in certification of medicinal and aromatic produce, do let us know. We will connect to the concerned certifying bodies. So with this, I wholeheartedly thank Dr. Manish Pandey. In spite of his busy schedule, he has made it possible today. So thank you very much, Dr. Saab. Thank you very much.
My pleasure. Yeah. Thank you for all the participants for their patient and attentive listening, and I hope they have some takeaways. But we will be always on standby through DMAPR to help you out if there is any further queries you have. Thank you so much, and have a wonderful weekend.
Yeah, thank you, sir. Thank you. You can take up for now. Yeah.
Nice.
So we'll continue. Yeah. Anyone, Ravi? We'll continue with this session. So now I'll introduce my next speaker, Dr. Deepa Patel, who is again business manager at Medi-Hub Technology Business Incubator, who will be talking about how incubators can facilitate you in developing your business and establishing your business entities. With this, Dr. Deepa, please go ahead.
Yes, I'm trying to share my screen.
Your connectivity is okay? I think so.
Seems to be.
Screen is not coming.
Yeah.
Meanwhile, to introduce Medi-Hub is a technology business incubator which is working on various aspects of business development. This Medi-Hub has been conceived with the funding support from ICAR, Indian Council of Agriculture Research, again through National Agricultural Innovation Fund. So we at Medi-Hub help our entrepreneurs or prospective entrepreneurs to convert their idea into business by providing technology consultation, business consultation, mentoring support, networking, and also other activities like infra facilities also we provide. So in which Dr. Deepa will be highlighting it. With this, Dr. Deepak, go ahead with your presentation.
Sir, is it visible in presentation mode?
Yes, go ahead. Yeah.
Okay. Thank you for the opportunity, sir. I'm Dr. Deepa Patel, and I'm helping out overall the incubatees and working as a business manager at Medi-Hub TVI. So many of you know me, and we shall discuss the market potentials of medicinal and aromatic plant sector in business point of view, and later on I'll give you some highlights on how can an incubation center can help you out, and what facilities in particular Medi-Hub TVI is offering to the incubatees. So to start with, as I discussed, that business environment to look upon, that we all know that today Everybody is getting more aware about that how medicinal plant produce are very much helpful, but to make it sure that herbal medicine serves as a primary healthcare need. So from ancient time it has been in use, and people are and market are getting aware these days. So yes, there is a more demand driven market these days, so that being an entrepreneur into this field, you can take advantage of. To more discuss into this, I shall quickly go through some of the opportunities. There are ample of opportunities available into this stream, because day in, day out, we get an example, and we get people coming with novel ideas. So that creativity at your end should be one USP into this to enter as an entrepreneur. But solely if we want to see that how this segment can be explored. So first of all, you can look upon for cultivation part, which is purely cultivation and seed industry and herbal tourism, garden kind of things. And then secondary, primary value addition includes sorting and other things, and secondary plant produce, secondary value addition to this medicinal plant produce can be herbal ice creams and herbal milk, herbal beverages, which are already available into the market, and it is a day in, day out we are using these things, but we are not, we are not getting aware that this thing is in use. See, even if we talk about herbal beverages and herbal chocolates and other things, we can say that even toothpaste are getting herbal these days, and even Colgate get an market driven demand that people are demanding this such herbal products, and even toothpaste, Colgate has to come up with a herbal brand, herbal segment into that. So those kind of variants we are looking here and there. Even this is not new herbal cosmetic, it is an age-old wisdom which we are having. But these days people are utilizing such knowledge very smartly and making business out of it. And yes, they are giving quality products, so that people are more used to those products, and they can get in success into the market. Herbal nutraceutical is the one segment which is trending these days. Herbal pesticides, yes, as everybody know that organic food and organic produce is very much into demand. So how to help out a farmer who is only into organic agriculture? So herbal pesticides is the one segment that you can tap upon, and it is a good opportunity these days. Herbal baby products, again, no, this is not a new idea, but yes, market is very wide and one can tap it easily. Herbal household cleaning products, even this is very much in demand. And as I discussed that how an incubation center can help. See, if you have any idea in your mind looking to such concepts, and if you have any any zeal to enter into such market, if you are already a businessman but you want to diversify and you also want to try this segment to achieve the target sales, if you are having any technical glitches, any of the any of the market oriented doubts, then you can definitely contact to incubation centers. And yes, any of the incubation center, I'm talking into general, that any of the incubation center can help you to save on rent, because they'll provide you the office facilities. They can help you improve focus. They will help you to connect for funding. They'll also help you to pitch back to the financiers, and you will overall you learn and grow with them. And yes, it is a perfect opportunity to make a good network with other startups as well, because they are having the same wavelength and energies as you have. So yes, it is a nice place to get linked with this kind of people. If we talk about in particular about Medi-Hub TBI, our vision is to commercialize innovations and to bring up startups into medicinal aromatic plant with best-in-class support system. When I say to bring up startups in MAPs, It is not only that you have to deal with raw drugs. Some of our incubators are also doing some with mushroom, and they are, incorporating medicinal plant into that, and they are coming out with tea and brews and what not. So innovation at its end is to be utilized into this segment. If we say that how this whole incubation process starts and from where it is starting and how it is going on, it is very simple. Incubation is a scientific term. Once you encounter any problem, then you come to the incubation center, and it always starts with an idea or let's say problem, right? And then you try to find out what solutions and what mechanisms to be worked upon that. And with the help of incubation process into that, you'll get so much expert advice onto your dilemmas, and then so many comments to be penned down, and so many decisions, so many plan A, B, C would be there to judge. And then you'll be always get aware about all the legal compliances, so that you don't end up making any of the mistakes into the law part. And yes, there is a good amount of checklist, and a business canvas model is prepared, and so after everything is done on blueprint and you are made aware of so many things, you are then ready to hit to the market. Again, when pilot studies are done into the market, you'll come to know that what are the difficulties which we have faced till now in the pilot study, and then you can again rectify on that with the help of the mentors and guiders who are guiding people who are into the field, or they are expert into the domain. Let's say more than 15 or 20 years experience they are already having. So you can utilize all this expertise and come up with certain solutions which you are facing into your business. If you talk about what facilities we provide, yes, we have requisite expertise available in the relevant area, and we facilitate innovations. Even we have an opportunity to give you to take ready-made technologies available here at our institute, which have been very focusedly been innovated by our scientists and group of scientists, I should say. So there are already ready-made available technologies. So technology transfer can be done from our end. And yes, the other facilities are like we always organize such kind of sensitization workshops and boot camps and company management webinars and seminars into this domain. So anything into this, if you find us appropriate, you can connect to us and we'll be able to help you out. So if in particular we talk about business, if you are looking up to for any technology consultations, you can connect to us, and we will be able to guide you with such kind of licensing part, and regarding registrations and so many things, legal compliances kind of thing. So that would be taken care of. Even business consultation here into this, it goes like assisting in business plan development, and go to market strategy, how to hit the market, and what are the best techniques to penetrate into the market with the existing product available. Then we can go on market surveys and rectify those. So any kind of connections, network into this are always needed, as in backward and forward market linkages and these things. So that's where we can help you. Again, in mentoring and networking, as I said, that we already have an requisite expertise available at our end. And more into this, if you're looking for particular some produce, then I'll announce that we are having, ICAR is having 50 agribusiness incubation centers, and each of incubation center is working on the particular product. So yes, mentoring and networking can be done easily, and expertise into any of the field would be provided to you. Let's say if it is in cotton or spices or anything you say. If you talk about infra facilities, as any government institutions, we are also having a very good infrastructure facilities and research and development labs, and lab scale production facilities are available. Office spaces are available, which are at very nominal rent, and meeting rooms and seminar rooms, and conference can be arranged at our place. So we are having ample infra facilities and access to funding. As I said, that we help out to make pitch decks, and we shall assist you in making a business plan proposals, and any linkages to banks and financial institutions and investors, and let's say any government schemes would be coming, we shall introduce you to those. So we make sure that you don't lose any opportunity when it comes to funding. Again, knowledge sharing is the key point which you can utilize by associating with any of the incubation cell. Moreover, if we talk about admission requirement to Medi-Hub TBI, it is very simple process. I have already pasted the link into the chat box. You can go through that. And yes, it is simple. Just online form you have to fill up. Your idea should be novel. You must have a commercially feasible business proposal. Anybody can enroll into this, and you should be free from legal aspect. And if we talk about Medi-Hub TBI's entrepreneurs tracing activity chart, we generally do such awareness programs. Until now, we were able to trace to reach out to around 2,500 people by such activities. And yes, there is a lot more to go into this. And some workshops we were able to do where it is a recent activity which we have started, where we are able to reach out to 200 plus people, and applications and visitors, yet we have received 200 plus into that Medi-Hub pool. And startup incubated with us are 19. So this is our story to get associated. You will know one by one that how we are helpful for your business. And again, as I said, onboarding process is very much simple. You just have to give an application submission, which is online. So it is, I mean, pan India, you can do that sitting at your desk, and no need to reach out to us in person here at our office. Internal screening would be done and shortlisting by this. Then it will go to the committee assessment. Even into committee assessment, we make sure that we are not judging you. It is just that we make sure that your domain area and our domain area matches, so that we can guide you and handhold you in a perfect way. And then the final decision would be communicated to the applicant. And the onboarding process is always very simple as an application. Even in onboarding, you just have to sign an MOU, which is a pre-defined format which is readily available. So if you enter at Medi-Hub, you don't have to go here and there for any of the documents, I must say. If we talk about some of the incubation detail we already have at our end is first of all is a 3 health product. This company is already working into some of the cosmetics and food into herbal segment. And now they are looking up to start an herbal room freshener and car freshener and multiple use air freshener kind of thing. So we are handholding them by giving the technical guidance into this. Next is Pharmantech. Pharmantech is again into herbal veterinary medicines, and Bilvam Herbal is again a woman-driven organization which is into nutraceuticals and food health supplements and cosmetics. If we say Sera Trust, it is an NGO kind of thing, and Sera Trust is working very vibrantly into the Vanapur, Andhra Pradesh and nearby villages, and they are maximum working into the crop diversification and making people aware that MAPs are more fruitful and they give more profits. So that's their job, and yes, they are getting success. If we discuss about Suhavya Nurturing Health, it is an Surat, Gujarat based company which is into herbal trading. Nuprana is again in mushroom. They are dealing into cordyceps in mushroom. And Vishwaksena Hub is a very unique company with us, which is doing into busy into this what do you call contract farming, and they are guiding the farmers from seed to market thing. So they are hand-holding, and even third-party financial assistance is also available with them. So all these are our incubatees, and we proudly say that yes, we are hand-holding them one or in one or another way. Let's say in technical part, in networking, in marketing, in refine the products and whatnot. So this is our story till now. Our visibility is, as you can say, we have a web page which you can visit, and any news would be there flashing on our website. You can go through. You can easily reach out us through WhatsApp. Even you can drop a mail at Medi-Hub tbi@gmail.com. And this is the Zoom ID, which is a permanent ID, which link you have clicked right now. So you can connect to us to that from any time. We even have a virtual flyer. Into that, you will come to know more about what the facilities and how we handhold our activities and other things. So it is already available on our webpage. You can visit there as well. We have a YouTube channel also for Medi-Hub TBI. And this is our contact details. You can kindly connect us through these, and please take a screenshot of this so that you don't miss out. And yes, this whole talk would be there posted on Medi-Hub YouTube channel, and I'll be sharing the links to all of you registered participants. So not to worry if you have missed any part of this. And any queries into this will happily answer you here or later, maybe, as in when you find a need to connect to us, you can do that. So yes, I'm open for any queries.
Yeah, thank you very much, Dr. Deepa, very well highlighting the role of Medi-Hub Technology Business Incubator in rendering incubation services to those enterprises who want to convert their idea into business. I think we can go for question and answers if anybody has any questions, so we can discuss. So yeah, anyone has any questions?
Yes, sir. Again,
yeah, Nitin. Yeah. So how are you, Nitin? Come on.
I'm good, sir. I'm good. How are you?
Yeah.
Yeah. A lot of questions. I guess you're not troubled.
No. We are not so. We are not so. We are happy to answer.
Okay, sir. One question, madam told that under ICAR there are 50 of the incubation centers. My question is, if I become an incubatee under ICAR incubator, so would Medi-Hub extend me like say hand-holding and mentorship or business consultation, or I need to exclusively be an incubatee of Medi-Hub?
So it is again, see.
So if not Medi-Hub, then what incubation cell you are planning to join?
Ma'am, bata do aapko.
No, you can join any incubation center.
Hey,
if anything is
sir, my
from
hurdle
us.
is right now I am serving. One more question was, if I have to join Medi-Hub, is there any virtual program? If it is not available, why don't you consider virtual program for working professionals like me and who are aspiring to?
It is there virtually.
It is 100% virtual.
Okay,
yeah, it is 100% virtual. We are having incubatees from Pan India, even from Chennai, and
wonderful,
many other places. So you can join hands, and yeah, I would say that COVID has taught us to become full-fledged virtual. So there is no issue, sir.
And other difficulty, sir, since I'm working, whether my individual application would be considered, or do I need to have a company which is registered, or I'm part of, or something like that?
No, nothing like that. Individuals
I can join.
Individuals with idea should join, and later they should propose their own enterprise.
Yeah, of course. Sir, I mean, I recollect faintly. I recollect a lot of information regarding team members or qualification, experience, domain experience was part of the form. Is it?
No, nothing like that. So there should be a team actually. Initially, you don't need anything. So when you start incubate your idea, later on you have to build your team and execute your plans. So this is what our so most of them have this kind of teams. That's why we have kept that application. Even if you don't have, also you can say no, you don't have at present.
Yeah. I will get in touch with you, sir. Thank you so much.
Definitely. To add on to this, even we are handholding students which don't even have logos for their, so they are starting from scratch. So anything is welcome. You can
Yeah,
connect
ma'am.
to us.
Great,
anytime.
great. Thank you, thank you. I will get in touch with you. Thank you.
So any other questions? Anybody has any questions? Yeah. So our domain area is very, very large. So we generally support all those commodities in agriculture. But our focus is on medicinal and aromatic plants. We are very comfortable working in medicinal and aromatic plants, looking at our expertise. So otherwise, we can connect you to the respective mentors in agriculture who can guide you. There was one question on the availability of technologies for commercialization. There is actually a technology manual. Dr. Deepa, you can share in the along with the YouTube link. So technology manual also you share. And it is already available in our website. You can visit us, DMAPR, icr.dmapr.gov.in is our website. You can visit there. We'll get all those.
There are a couple of questions for YouTube link as well. Yes, I'll post it on YouTube, and then once the link is generated, I'll share with the registered email address. That's where I will be sharing our Medi-Hub flyer as well as this bulletin which sir is talking about, so that you'll come to know that what technologies which are readily available and which are available at many very much minimal charges because they are patented. So there are ample of opportunities. You just need to tap into. Any government schemes for aromatic plant distillation is the query in the chat box, sir.
Oh, so a lot of national horticulture mission programs are there running across at the district level. Please try to contact your district horticulture officer who can help you in getting the schemes. And prior to that, you should know how much you want to go and how long you want to go and what are all your requirements. So such schemes are available. Even Aroma Mission of CSR is also working. So they can also give you, if you a cluster of farmers are there, cluster of farmers of more than 50 or 25 farmers. So then a common distillation facility will be created and given to you. So that kind of schemes may be explored. Okay, otherwise individual, you can also start to set up distillation units, which may cost around 5 to 6 lakh rupees. So please arrange a session for processing of medicinal and aromatic plants, their marketing and certification for domestic as well as foreign markets. So Bubbly Datta is asking.
So that's what ma'am we are doing. If you try to connect through Medi-Hub channel, by joining all the dots, you'll know that half of the diploma course is already available on our channel.
Yeah.
So yeah, and this is our regular exercise. Every fortnight we do this. So because it is a very vast field, right? So it cannot be compiled into one particular module and can be given to you. So this is our regular exercise what we are doing, and you can try to surfing all the videos and you'll get lot of knowledge out of that. And in particular, if you're looking for any assistance, try to connect with us directly so that we can give you one-to-one assistance on that. Any queries into this, you can please call out and ask.
So can you teach how to prepare herbal products like freshener and others? We can teach you, provided you have to join our incubation program. So there is no issue on that one. So because it is one-to-one program, we will be teaching you how to do various herbal products and other things. So there is always a chemistry wing is there working on various aspects of product development, like what you are thinking of. So such kind of, we will be linking up with them and we will be teaching you. Yeah. So Jyoti from Hyderabad want your incubation to grow many companies. Is any person in Hyderabad working from Medi-Hub? Our incubator from Hyderabad is there. So Dr. Cynthia, Madam Cynthia Padala is there, who is a owner of Sera Trust. She is from Hyderabad. So especially this Vanaparthi, she is working. So is there any government scheme in medicinal and aromatic plant nursery and products? Yes, there is schemes. You just contact National Medicinal Plant Board or any of your state medicinal plant board also. You can contact them and send a proposal of establishing a plant nursery. So they will fund you. Okay. Any other questions from the participants? I think we had elaborate discussion on various aspects of this quality certification, especially voluntary certification scheme for medicinal and aromatic medicinal produce. And also followed by, we had the discussion on Medi-Hub Technology Business Incubator, converting your ideas into businesses. So with this,
Somebody
I think,
speaking, I think. Somebody
yeah,
is
anyone
speaking.
has any questions? Yeah. Okay, nobody is there. Otherwise, get connected with us. We can share you our numbers. So you can disturb us at any time. So we are happy to help you and handhold you. With this, I think we'll be closing the session. Thank you very much for your patient listening. And we had a wonderful session we had, and wish you all the best and good day. Thank you very much. So we'll close the session. Yeah.
Yeah.
Thank you.
Thank you. Good day all.